So we proceed to the last talk on medicinal leech enzymes and their use potential in pharmacology and cosmetics. It will be delivered by Dr. Hüseyin AYHAN from Ankara Eğirdir Beyazıt University of Turkey. Please, you have the floor.
Evet, teşekkür ederim. Herhalde benim sunum sıram geldi, Victor.
Thank you very much. I think it's my time now. Thank you very much, Mr. Victor.
Paylaşım yapıyorum hemen.
I'll share my screen.
Geldi mi acaba şey?
Can you see my screen right now? Can you all see my screen in
Yes.
full screen?
Yes, we can see it.
Bugün sizlere tıbbi...
So today we will be talking about medicinal leech enzymes and their use potential in pharmacology and cosmetics. We will talk about its specific potential in cosmetics especially. So when we look at the history of medicinal leech, we see that it has been used for thousands of years by the Egyptian, Indian, Greek, and Arab physicians. And the first written resources on the therapeutic use of leeches were found in Egypt BC. It's accounted in 1,500 years ago, and the philosophers such as Nisander, Pliny, Galen, Hippocrates, and Ibicina talked about leech therapy in their works. And the main application in leech therapy was blood drawing. So the excessive blood was thought to be harmful. But later on, with the activities carried out, with the research studies carried out, it was realized that the blood sucking, the blood drawing was not the only way. But also, nowadays, leeches are also used in the treatment of painful conditions, and now they're also releasing their own enzymes to the blood. So currently they are used in the treatment of painful conditions, circularity disorders, or the problems related to infertility even. So leeches are especially called precious metal by the microsurgeons and life pharmacies by the British, since they have many lively bioactive compounds, and since they are used in the treatment of many diseases, they are called life pharmacies, and they are called holy animals by the Tatars. Leech injects a secretion containing many bioactive compounds into the tissue during blood sucking. And these bioactive substances are having analgesic, anticoagulant, anti-inflammatory, biorelaxant, immune modulator, vascular circulation regulator, and hypoxia suppressant features. So in a sense, they are actually releasing different kind of medicine into the human tissue and body. So when we look at the overall picture, we see that saliva proteins and peptides that are secreted reach the jaws of the leech through thousands of tiny saliva gland cell channels, and then it's stored there, and then it's transferred to the host's vascular system. Soon, a research study of ours will be released on the teeth and on the jaw of the leech, and about it, various pictures are available. This is one of the pictures that we have used in our study. We have taken this picture during our study. As you see, there are 3 jaws, and on top of those, there are around 70 to 100 teeth, and there are certain gaps in between, some spaces, and from the gland the enzymes are coming on, and this is where they are transferred to the host's vascular system. So they have 3 jaws. We see how they are placed, and their jaws structure is very muscular, spongy, and covered with cuticles. And there are a row of teeth arranged at the tip. And as we said, the number of teeth is very important. This is what the research studies show us. So this is a table that we can show you about the bioactive substances and their functions. Hirudo, it inhibits blood coagulation by binding to thrombin. And Calin inhibits blood coagulation by blocking the binding of von Willebrand factor to collagen and inhibits collagen-mediated platelet aggregation. And the other one dissolves fibrin within monometric activity and shows thrombolytic effect. We are talking about the stabilis here. Again, hirustatin, Budelenstrypsin, Neurodones are the other bioactive substances. When we look at the Budelenstrypsin, we see it's anti-inflammatory, inhibits plasmin, trypsin, and acrosin. Hyaluronidas increases interstitial viscosity and shows antibiotic effect. Currently, it's widely used in cosmetic sector. In Botox treatment, it's widely used. Hyaluronic acid is benefiting from it. The tryptase inhibitor is very important. It suppresses the mast cells by inhibiting the proteolytic enzymes. So they create a cut, an invasive procedure, and the immune system reacts to it to prevent it. So the immune system is activated immediately. Tryptos inhibitor is blocking this system. We have englins. They are anti-inflammatory and inhibits the activity of chromotripsin, chiamase, substilicin, elastase, and cathepsin G. When we look at factor XA inhibitor, it inhibits the activity of coagulation factor XA by forming complexes with the same molecular densities. When we look at the carboxypeptidase A, it increases the blood supply of the bited area. As you know, the leech does the blood sucking for its own adaptation. To be able to be fed properly, they are releasing those bioactive substances. But while benefiting from it individually, on the other hand, on the bite area, since they are also releasing those substances into the human bodies, they are also benefiting those. Not only human bodies, actually, many domestic animals are also benefiting from the advantages of the blood sucking of leeches. When we look at Hirudo, we said it's a strong anticoagulant substance. In 1884, Highcroft identified a substance that prevents blood clotting in the saliva secretion of the leech and named this bioactive substance Hirudo. Especially, it used for prophylaxis and the treatment of postoperative venous thrombosis to prevent reocclusion and may be indicated for plastic surgery. Hirudo may be a useful alternative anticoagulant, and particularly in patients sensitive to heparin or in patients with inherited or acquired antithrombin 3 deficiency, it may be a useful substance. So the production techniques, manufacturing techniques are still ongoing on many different areas. We look at choline now. It prevents the binding of von Willebrand factor to collagen and prevents blood clotting. Here in this area that I'm showing right now on the screen. Here it's inhibited and it inhibits collagen-mediated platelet aggregation onto the surface. So it can also be considered as the long-lasting bleeding. So 4 to 48 hours of bleeding can be ensured by choline. So choline can be the reasons of long-lasting bleeding. Dastablast is a very important lysosome. As you see here on the screen, on the shape here, dastablast lysosome is the first invertebrate lysosome to have an enzymatic and non-enzymatic antibacterial action and also dissolves blood clots. It provides anticoagulant substances. But this dastablast enzyme dissolves also the other one, therefore it's a very important feature, we would say. We have hirustatin. It's also called Hirudo antistatin. So it belongs to a class of serine protease inhibitors. I think there is a background noise, by the way. Someone else's mic can be on. The mics are on. You need to mute your mics if you're not using your mics actively. Please do so. Again, we have trypsin, kallikrein, chymotrypsin, neurotropic captepsin. It was first isolated from the salivary glands of the Mexican leech, Hamantaria officinalis. A protein similar to antistacin has been isolated from Amazonian leech, and it was named gelantin. Hirustatin binds specifically to the tissue kallikrein. Anastatin and gelantin are potent specific inhibitors of the blood clotting factor XA. So they are strong inhibitors. They again have the same effect. As you see, anticoagulant substances are released to the bited area. We have Budelenstrypsin, plasmin, and sperm acrosine inhibitors were first discovered in 1969. It was discovered in 1969, and again, it was isolated from Hirudo medicinalis. To control bleeding, it's used as a plasmin inhibitor. It's very strange that they both release anticoagulant substances, so it ensures the flow of blood, and it releases choline compounds, ensuring bleeding, but on the other hand, they are releasing compounds that are controlling the bleeding. So when it's systematically administered, they can rapidly extract it in the urine. So actually, there are many bioactive compounds, and they can easily be extracted from the body through urine. When we look at the Neurodones, it's a naturally occurring enzyme that breaks down hyaluronic acid, one of the 4 main glucosaminogens that regulates the permeability of the connective tissue in the intercellular matrix. Here you can see that they are separating those 2 compounds, and it increases and ensures the permeability of the connective tissue among the cells. What does it mean? So from one place to another, from one cell to another, it can easily be transmitted. It decreases viscosity and it ensures the penetration, increasing the absorption rate of the fluids. It promotes the absorption of fluids and extravasated blood from the tissues and also increases the effectiveness. Tryptos inhibitor is an enzyme that plays a key role in the pathogenesis of allergic and inflammatory reactions associated with the mast cell function. Tryptos is also associated with diseases such as asthma, rheumatoid arthritis, and psoriasis. So the leeches secrete tryptase inhibitors to inhibit proteolytic enzymes released by their host's mast cells when they pierce the skin. So they suppresses the mast cells, and at the coated place, the immune system at that point can be prevented from reacting. I'll touch upon Eglactin very briefly. Again, they are anti-inflammatory compounds. Around 20 micrograms of Eglactin is there within one leech, and Eglactin-like serine proteinase inhibitors have been isolated from the leaches Hirudo medicinalis and other leech variety. Here you can see factor XA inhibitor. It inhibits the activity and ensures anticoagulant activity. When we look at carboxypeptidase A, it increases the blood supply of the bited area. So it supplies blood, additional blood, we can say. And in this way, the leech can be fed in an easier manner. By FDA, this therapeutic agent was approved. They have histamine, serotonin, immune modulators, enzymes, proteinase inhibitors, and antimicrobial agent. They also involve all these, and liposomal leech saliva extract relieved too much effect on the human breast carcinoma cell line, cancer cell line. So we have the indications of leech therapy for cardiovascular diseases. For the mass and skeletal system diseases, they are effective. I don't want to touch upon those. I don't want to go into detail so as not to take much of your time. So they are also used in neurological diseases, in microsurgery, reconstructive surgery. They are also implemented, used skin diseases, eye diseases. As we said, alopecia, for example, is an important skin disease. It can suppress the effects of alopecia, and also in eye diseases it can be used, especially in glaucoma, in ocular vascular conditions. They can be used. Also, the same way they can be used for ear, nose, and throat diseases. They can be quite effective, and this was proved by many research studies. For respiratory diseases, it has also been identified as an effective method. And for dental diseases and for urological diseases, especially for infertility in gynecology, again, it was implemented and positive results were obtained. These are all mentioned in the worldwide literature, in the international literature. Again, gastrointestinal diseases are among the diseases it can be used for the treatment. As you see here in the case, there is this facial subcutaneous hematoma, and leech therapy is used here for the elimination of hematoma. Again, for diabetes, it can be used around the world. Every 30 seconds, a lower limb amputation is carried out due to diabetes throughout the world. And the mortality rate due to diabetic foot gangrene is just next to that of a cancer. Since as the tissue that cannot be reversed, surgical removal of the affected tissue or amputation of the limb is the only treatment option left when the gangrene has advanced. So it can be the only treatment option once it's advanced, especially. You can see some pictures of the therapy, Hirudo therapy, on various ulcer forms, again on some experiments. In some experiments, some positive results, useful results were obtained. So in conclusion, we all know that the production currently is not ongoing in our country. So currently these compounds are not produced, and therefore leech use has been very widespread. In order to meet the increasing demand, medical leech breeding under sterile conditions needs to be expanded and increased. In our country and in the world, disseminating the medical leech breeding, the production of leeches, are very critical. Applications in model and sterile conditions in medical leech enterprises, reducing leech collecting from the nature and establishing the most appropriate breeding protocols should be provided. So opportunities should be provided. But currently there is these leech breeding, but sterile conditions may be missing, or the feeding of the leech can be a deficiency, a missing point, because to eliminate the deaths after feeding, we need to work on the solution offers. To be able to eliminate the problems, the relevant work has been carried out, as I said before. Especially academics have a very important role to play. And even for standard breeding, a protocol should be created in our country as well. It has not been there yet. So obtaining bioactive compound products with high added value from the medicinal leeches and developing processes should be the original part of the research. Public university industry cooperation should be expanded in this field. As mentioned by İlhan Aydın, TAGEM, University, TÜBİTAK should come together, and relevant institutions should come together to carry the research on the medicinal leech production. So hopefully in the near future, those research studies number will be increased. So a patented model regarding technological and hygienic production conditions should be developed for the medical leech investor. Some pure bioactive products obtained from the leech are sold at very high prices. Even some small amounts are sold at very high prices. Therefore, the importance of production is very, very critical. Generally, leeches are used alive in our country, therefore they are facing extinction, and the standards should be put forward to eliminate the risk of extinction for these specific medicinal leech species. So sterile leech plant models should be developed, and sterile leech plant models should be developed, and all the producing companies should be supported to further improve their works and activities. With these facility models, both the leech species and the production models would be preserved. So production, breeding, stocking, brood supply, rearing, feeding, environmental criteria, diseases, these are all the challenges to be overcome. First of all, they need to be identified, then they need to be solved. Again, the leech trade carried out illegally around the world, and it should be brought under control. So with an international committee, maybe this can be ensured. And lastly, I would like to say goodbye with a nice statement of Ibn Sina. Life goes where blood goes. So since the leech provides the blood flow, it's also giving life. Thank you very much for listening to me. I would like to thank everyone for your attention.
Thank you also for the very interesting presentation. Because we have no time for the questions, so you are asked to address all the questions in private. So now it's time to go to the concluding remarks, and I will give the floor to Mustafa Ceylan, please.
Victor, teşekkür ederim.
Well, Victor, thank you.
Sorry, it was a tough task to shorten the discussion, because they are very interesting, of course, but unfortunately we are in a shortage of time, so we need to stop now and to pass to the next step, the concluding remarks.
Ben de aksine süreyi iyi yönettiniz.
Well, just the contrary, I believe that you managed the time very successfully, and you left us some space and some time for further discussion to close this session. Just